Welcome to this discussion on multiple myeloma. We'll be tackling key questions about this cancer of plasma cells. Let's dive right in. So what's the most common age range for diagnosis?
The most common age range for a multiple myeloma diagnosis is 65 to 74 years old with a median age of 69.
Interesting, right? And what are the major complications often associated with the disease?
The CRAB criteria are key: hypercalcemia C, renal issues are anemia A, and bone disease B.
So CRAB helps in diagnosis, I see. What about treatment? What's the first step, typically?
Induction therapy is usually the first step, often involving a combination of drugs like bortezomib, lenalidomide, and dexamethasone.
Let's delve deeper into diagnosis. What tests are typically involved?
Blood tests, urine analysis, imaging X-rays or MRIs, and a bone marrow biopsy are crucial for diagnosis.
Okay. And what are some of the common symptoms patients experience?
Common symptoms include bone pain, fatigue, frequent infections, and kidney problems.
Yeah.
How prevalent is anemia among multiple myeloma patients?
Anemia affects approximately 73% of multiple myeloma patients.
You mentioned induction therapy, right? What about stem cell transplantation?
Stem cell transplantation is often used after induction therapy for eligible patients, aiming for deeper remission.
What are some other key treatment approaches?
Proteasome inhibitors, immunomodulatory drugs, and monoclonal antibodies are all important treatment components.
And what about the role of bisphosphonates?
Bisphosphonates like zoledronic acid help manage bone disease by reducing bone breakdown.
Let's discuss hypercalcemia. How common is it, and how is it treated?
Hypercalcemia occurs in about 28% of patients and is treated with IV fluids, calcitonin, and bisphosphonates.
Okay. What about kidney issues? What causes them in multiple myeloma patients?
Kidney damage can result from light chain protein deposits, dehydration, or hypercalcemia.
And how common is peripheral neuropathy as a side effect of treatment?
Peripheral neuropathy is a common side effect, often managed through dose adjustments or switching medications.
What's the current 5-year survival rate for multiple myeloma?
The 5-year survival rate has increased to over 55%, significantly improved from 32% in 2000.
Wow, that's good news. What role does maintenance therapy play in long-term management?
Maintenance therapy, using low-dose medication, helps delay relapse and prolong remission.
And what lifestyle changes can patients make to support their treatment?
Staying active, maintaining hydration, and eating a balanced diet are all beneficial.
What kind of supportive care is crucial for multiple myeloma patients?
Supportive care focuses on managing symptoms and side effects, including anemia, bone health, and infection prevention.
How can infection risk be reduced in these patients?
Vaccines, antiviral drugs, and antibiotics, along with good hygiene, are vital for infection prevention.
Right. What is the role of pharmacists in multiple myeloma care?
Pharmacists manage drug interactions, ensure correct dosing, and educate patients about their medications.
What is CAR T-cell therapy, and how is it used in multiple myeloma?
CAR T-cell therapy modifies a patient's T cells to target myeloma cells, used for relapsed or refractory cases.
When is radiation therapy used in multiple myeloma?
Radiation therapy is used to manage localized symptoms like bone pain or spinal cord compression.
Okay. What is the role of immunomodulatory drugs, or IMs, in treatment?
IMs like lenalidomide and pomalidomide boost the immune system to target myeloma cells.
Why is regular monitoring so important for multiple myeloma patients?
Regular monitoring helps assess treatment response, detect complications, and catch relapses early.
What are the options if multiple myeloma relapses?
Treatment options for relapse depend on prior therapies and patient health, including second-line drugs and potentially a second transplant.
What are some common side effects of multiple myeloma treatment?
Common side effects include fatigue, nausea, peripheral neuropathy, and low blood counts.
Are there any specific genetic mutations linked to multiple myeloma?
Genetic mutations in plasma cells lead to uncontrolled growth, increasing the risk of developing the disease.
That was a great discussion. Thank you for clarifying these important aspects of multiple myeloma. It was really helpful.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.